Hypoparathyroidism. Hypoparathyroidism, there is decreased secretion of the parathyroid hormone from the parathyroid gland. Now, hypoparathyroidism can be classified into three types: primary hypoparathyroidism, pseudo, and pseudo-pseudo. Primary hypoparathyroidism, mainly it is due to damage or destruction of the parathyroid gland, removal, mainly surgical removals. Then autoimmune diseases can cause primary hypoparathyroidism, and some congenital disorders, some genetical disorders can cause primary hypothyroidism. That means the problem itself is in the parathyroid gland. So there is decreased secretion of the parathyroid hormone. In pseudo hypoparathyroidism, from the name itself it is indicating that pseudo hypoparathyroidism. That means the parathyroid gland is normal, the secretion of the parathyroid hormone is also normal, but the epithelial cells are unable to utilize the parathyroid hormone. Now, pseudo hypoparathyroidism, it is very rare, and it is very rare in human and rare in animals also, and it is because of some genetical defects. Now, biochemical features of the hypoparathyroidism are mainly hypocalcemia, because the parathyroid hormone, it is hypercalcemic. In absence of the parathyroid hormone, calcium will be decreased in the blood. Then hyperphosphatemia, because the parathyroid hormone, it inhibit the reabsorption of the phosphate from the proximal convoluted tubules from the kidneys. So in absence of the parathyroid hormone, the phosphate is reabsorbed, and it may reabsorb, the reabsorption is increased, so there is increased level of phosphate in the blood, so there is hyperphosphatemia. Then hypocalciuria, because the calcium is not absorbed from the intestine itself, so there is hypocalcemia as well as hypocalciuria. Then signs and symptoms of the hypoparathyroidism is related with the hypocalcemia. We know the calcium, it is the function of the calcium is mainly the action potential generation. So there is problem in the nerve conduction. So there is neuromuscular irritability, there may be spasm of the muscles, bronchospasm may be there, then abnormal heart contraction, there is abnormal atrial fibrillation, there is hypotension, and there will be some abnormality in the bone, abnormality in the teeth, because of the hypocalcemia. And pseudo hypoparathyroidism, there is normal parathyroid gland and normal parathyroid hormone level in the blood. Tissues fail to respond to the parathyroid hormone, and it is caused by rare inherited condition with an autosomal dominant character.